Hi guys, welcome to Fast Coder 21 Medical Coding YouTube channel. Recently we have started ICD-10 CM 2023 chapter guideline series. We have posted 1, 2, 3 chapters in 4 chapters in our channel. Now today we are going to learn chapter 5 mental, behavioral and neurodevelopmental disorder. Code series ranges from F01 to F99. Remaining 4 chapters, please watch Fast Coder 21 Medical Coding YouTube channel. Please like, subscribe, comment and share our channel to help to get more informational sessions. Guys, whenever we learn new chapter in ICD-10 CM, we need to learn the basic terminology related to that section. So in this section, we are going to learn few keywords or few terminology which are related to mental, behavioral and neurodevelopment disorders, which are very essential to understand before going into the guidelines. So in chapter 5, we have few keywords which we need to learn before going into the guidelines. Sorry. So first terminology is remission. So remission is defined as a period of improvement of sufficient magnitude such that the individual is virtually asymptomatic. So it is basically patient has the abuse or dependence previously, but he is reduced to the very low level. So and also he is asymptomatic. So in that situation, we will use remission. As all of us know, in this chapter 5, we have more codes related to remission, relapse, use. So basically remission means patient is decreasing their intake and they are asymptomatic now. Next terminology, relapse. Relapse refers to the return of symptoms during remission, while recurrence implies a completely new episode of depression. So basically, relapse is the reverse of remission. In remission, patient is asymptomatic. But in relapse, patient again started to have symptoms of drug abuse. Next word, the use of alcohol or other drugs to socialize and feel effects. Use may not appear abusive and may not lead to dependence. Use is social purpose. The patient will use the drugs or alcohol. It will not at all related to the dependence and it may not lead to the dependence. Next word, abuse. Recurrent substance use resulting in failure to fulfill obligations at work, home or school puts the patient in a situation that is physically hazardous, result in legal problems or interpersonal problems. So basically abuse means without drug or alcohol the patient can't survive and he is very addicted to drugs or alcohol, and because of that patient may face legal problems too. So dependence, usually we'll call dependence as addiction also, is a pattern of continuous use with 3 or more of the following symptoms. So we need to check the documentation if the patient have all these symptoms or not. So first symptom is needing more to get high. So he wants to more drug or alcohol, so taken in large amounts over a longer period of time. So he wants more drug or alcohol in a longer period of time. Causes withdrawal symptoms when not used. Use is an important social, occupational, or recreational activity. A great deal of time is spent using, obtaining, or recovering from its effects, and our patient has desire or is unsuccessful to cut down use. So basically, in dependence, patient will be addicted to drug or alcohol. So within 3 or more following symptoms, we will consider it is a dependence. So patient is high. So high means patient wants more alcohol or drug and withdrawal symptoms when not used. So if the patient has no drug or alcohol, he may show withdrawal symptoms. If the drug is drug or alcohol is not available. Next, we will learn ICD-10 CM 2023 guidelines. So, pain disorders related to psychological factors. So, assign code F45.41 for pain that is exclusively related to psychological disorders. As indicated by the excludes one note under category G89, a code from category G89 should not be assigned with code F45.41. So if the patient has pain related to psychological disorders, we need to use F45.41. So here we can't use G89 as G89 has one excludes one note. So with G89 we can't use F45.41 code. So G89 is normal pain unspecified code. Next, code 45.42 pain disorders with related psychological factors should be used with a code from G89 pain, not elsewhere classified if there is documentation of a psychological component for a patient with acute or chronic pain. So basically what it tells us is if the patient has psychological factors as well as acute or chronic pain, we need to use F45.42 as well as G89 series code. So here we have an example. Ross is receiving behavioral therapy for treatment of chronic pain syndrome with associated psychological factors. So here we can code G89.4 first, F45.42. Why means because of this psychological factors which is chronic pain syndrome due to psychological factors, we need to use G89.4 and F45.42. So you need to remember here F45.41 is for pain that is exclusively related to psychological disorders. But whereas 545.42 pain disorders with related psychological factors. So if the patient has psychological factors along with pain, we can code both. If the patient has psychological disorder, we can't code G89 series. If the patient has psychological factors, we can code G89 series here. Next guideline, mental and behavioral disorder due to psychoactive substance use. As we learned remission initially, it will be very easy for us to learn remission. Selection of codes describing in remission for categories F10 to F19, mental and behavioral disorders due to psychoactive substance use requires the provider's clinical judgment and are assigned only on the basis of provider documentation unless otherwise instructed by the classification. So whenever we code remission codes, we need to check the physician documentation to get the more clear explanation to code remission. So mild substance use disorders in early or sustained remission are classified to the appropriate code for substance abuse in remission, and moderate or severe substance use disorders in early or sustained remissions are classified to the appropriate codes for the substance dependence in remission. So basically here for mild substance use disorders, we need to code substance abuse in remission code. For moderate or severe substance use disorders, we need to code substance dependence in remission. So we have few examples here. Doe has a history of alcohol dependence, currently in remission. So he is decreasing his volume of taking alcohol. Here we can code F10.21. So for alcohol remission, we have coded F10.21. Next example. Gina is a 38-year-old female currently receiving treatment for alcohol dependence. So without alcohol, she can't survive. So which is dependence? Usually we will call it as addiction too. The patient also has a history of heroin use and dependence and is currently in remission. So heroin use, she is in remission. In this scenario, F10.20 dependence alcohol without remission and F11.21 opioid dependence in remission both can be reported. So we need to code based on the drug we need, using by the patient. So first statement, she is using alcohol, and second statement, she is using heroin. So we need to code both codes for alcohol as well as the heroin based on their remission, relapse, use or abuse based on the documentation. So we have one more example here. Rob has a 15-year history of alcohol dependence and consumes high levels of alcohol daily. The patient was admitted for alcohol detoxification and rehabilitation. The patient began having withdrawal symptoms with delirium tremors. The correct code is F10.231, alcohol dependence with withdrawal delirium. So whenever we code chapter 5, we need to check the documentation properly in order to code. Next example, Gerald presents to the office with personal history of alcohol dependence. What code we can use? F10.21. So alcohol, as it is a history, he might be in remission, so we need to use F10.21. So next guideline, psychoactive substance use, abuse and dependence. So when the provider documentation refers to use, abuse and dependence of the same substance, example alcohol, opiate, cannabis, etc. So alcohol, if the provider documents alcohol use, alcohol abuse and alcohol dependence, only one code should be assigned to identify the pattern of the use based on the following hierarchy. So for example, if the provider mentions in the documentations like alcohol use, alcohol abuse, alcohol dependence, we know to code more severe condition or more severe, which is alcohol dependence. So we have guidelines here, we will check those. So if both use and abuse are documented, we need to code only abuse. So if the provider documents alcohol abuse and alcohol use, we need to code alcohol abuse code only. Next one, if both abuse and dependence are documented, assign only the code for dependence. So here it is, as it is mentioned directly, if we have abuse and dependence, we need to code dependence only. If use, abuse and dependence are all documented, assign only the code for dependence as we learned initially. So if both use and dependence are documented, assign only the code for dependence. So we need to understand here that so among use, abuse and dependence, dependence is the more severe form of the intake. So we need to code more severe form whenever provider documents use, abuse and dependence. Next guideline, psychoactive substance use unspecified. As with all other unspecified diagnoses, the codes for unspecified psychoactive substance use should only be assigned based on provider documentation and when they meet the definition of a reportable diagnosis. So if the provider mentions unspecified diagnosis, we need to code unspecified code only. So these codes are to be used only when the psychoactive substance use is associated with substance related disorders or mental condition, and such a relationship is documented by the provider. So we have an example here. Gabriel presents with an anxiety disorder due to cocaine abuse. How do we code this one? F14.180, cocaine abuse with cocaine induced anxiety disorder. So next guideline, medical conditions due to psychoactive substance use, abuse and dependence. So medical conditions due to substance use, abuse and dependence are not classified as substance-induced disorders. Assign the diagnosis code for the medical condition as directed by the alphabetical index along with the appropriate psychoactive substance use, abuse and dependence code. So basically here, medical conditions due to substance use, abuse, dependence are not classified as substance-induced disorder. So those conditions are not related to substance abuse. So we need to code the medical condition separately using the alphabetic index. So we have an example here. For alcoholic pancreatitis due to alcohol dependence, we need to assign the code from category K85.2 alcohol induced acute pancreatitis and the appropriate code from category F10.2 such as F10.20 alcohol dependence uncomplicated. It would not be appropriate to assign code F10.288 alcohol dependence with other alcohol induced disorders. So basically, because of the patient's intake of alcohol, if the patient has any type of disorder like pancreatitis, we need to code pancreatitis as the PDX and alcohol dependence or abuse as the secondary diagnosis. Next one is blood alcohol level. A code from Y90 evidence of alcohol involvement determined by blood alcohol level may be assigned when this information is documented and the patient's provider has documented a condition classifiable to category F10 alcohol related disorders. The blood alcohol level does not need to be documented by the patient's provider in order for it to be coded. So basically whenever patient has a alcohol related disorder, we need to code Y90 alcohol level, blood alcohol level. So basically this blood alcohol level need not to be provided by the physician. We can take it from anywhere in the documentation. So next one is fracture disorders, which is a rare condition. No need to worry about that. So in 2023, we have latest guideline regarding dementia. We need to learn about that dementia. So the ICD-10 CM classifies dementia categories F01, F02 and F03 on the basis of the etiology and severity. So if we take severity, we can classify it as unspecified, mild, moderate and severe. So selection of the appropriate severity level requires the provider clinical judgment and code should assign only on the basis of the provider documentation unless otherwise indicated by the classification. If the documentation does not provide information about the severity of dementia, assign the appropriate code for unspecified severity. So, in order to code dementia, we need to check the dementia severity first, whether it is unspecified, mild, moderate, or severe. If we don't find any severity in the documentation, we need to code unspecified dementia. We have an example here. If a patient is admitted to an inpatient acute care hospital or other inpatient facility setting with dementia at one severity level and it progressed to higher severity level, assign one code for the highest severity level reported during the stay. So for example, whenever the patient is admitted, patient has mild dementia, but during the stay, if the patient has severe dementia, we need to code high severity, which is severe dementia, we need to code. Guys, here we will complete chapter 5th. I hope you guys learned something from this session. If you have any comments, please mention in the comment section. Please like, subscribe and share our channel to your friends or in your circle. Thanks for watching Fast Code 21.